doesn't seem good. Sagittal PD with fat saturation, it is sagittal T1. It says she has gone through surgery 6 years ago, and it hurts and it's swollen. So let's see what we can do. And surgery, I can tell this patient is obese, clearly obese. Indeed, there was surgery. She had a fibular fracture right there, and there are some signs of an old, yep, right there, a scar tissue right there. This is a suture, vertical suture, and there were some bolts here, metallic bolts, and they left some residue, which you can see. There is arthrosis of the ankle, moderate arthrosis, also some signs of arthrosis of the subtalar joints, and the intertarsal joints right there, also arthrosis. We have osteophytes, and we have spurs, bone spurs right there, and there, and there on the calcaneals, and the plantar fascia. So there is tendinosis there, at least mild. There is thickening and a signal intensity change on the PD with fat saturation, also on the T1. So this is chronic disease. Also, this is also chronic disease. And there is arthrosis. Of course, it's going to swallow. No, it's to get swollen and to hurt. So there is also edema of the superficial tissues and hypertrophy of the muscles, fat infiltration like that. Let's see the ligaments. Oh, there is arthrosis right there. This is arthrosis for sure, but the talofibular ligaments are fine. Let's see on the PD. Yep, ligaments fine. Anterior and posterior. Can't really tell, but this is clearly a normal right there. A normal calcaneofibular ligament right there at the bottom of the fibular tendons lies the fibular calcaneal ligament. This is what we should be looking for, and it looks fine. It's better to look for it on the coronal view right there. See, this is what we're looking for. Fibular calcaneal ligament is fine, and also the fibular anterior tibiofibular ligament is also fine. Let's look for deltoid ruptures. Okay, as much as we can tell, seem fine, nothing much. Also arthrosis, that is clear arthrosis of the tibiofibular syndesmosis. There is also arthrosis right there. Yes, arthrosis. This is this bone scar tissue related to the bolts. There was probably also some bolt right here on the malleolus tibialis, because no, it's very common for this to fracture as well when you have a fibular fracture right there. The posterior tibial tendon is clearly not normal, so posterior tibialis tendon, it's thickened and has diffuse signal intensity, heterogeneity of its signal intensity. It's bright and heterogeneous, so it's tendinosis. Let's see. Fibular tendons, brevis and longus. Oh, this is bad. See? This is a chronic rupture. Yes. The posterior tibial tendon is ruptured. Complete rupture right there. Yes. This is related to trauma for sure. So, posterior tibial tendon is ruptured. There is tendinosis of the calcaneus and tendinosis, of course, of the plantar fascia. Yes, so we have a bunch of stuff to report on this ankle. So let's report it before it's too late and move on to the next one.